Those folks in LaPorte have commissioned a first-of-its-kind report to try to bring an end to this crisis. Now, the focus is on identifying gaps in treatment, which one recovering addict turned mentor experienced firsthand. From the outside, the sun seems to be smiling on the city of LaPorte, but get to the ground level, and you can see addiction has cast a shadow on these streets.
I remember it ended up in the floor, laying there listening to my babies cry in the background, thinking, I'm gonna die, and I deserve it. And my babies are gonna grow up knowing that their mom was a junkie. It was either let me die right here, right now, or let me make it out of this. And I was fortunate enough to make it out.
LaPorte native Tony Mandeville made it out 26 years ago, but she took the lonely road.
I didn't have rehab. I didn't have detox. I didn't have 12-step meetings. I didn't have counseling. I didn't have a mentor. I didn't have a support system. I had me. And I don't suggest anybody go that route because it's not easy.
Not easy, and no right way, Tony says.
There's a million different ways to get there, and the bottom line is it doesn't matter how you get there as long as you get there safe.
To arrive safely, you're probably going to need a map, and that's what the Healthcare Foundation of LaPorte is hoping to provide.
So we contracted the Center for Health Policy that did an incredible research and a report on the toll of opioid use in Indiana and Marion County in September of 2016. We decided that we really would like to have a study tailored to LaPorte County. So that was the decision to use those dollars, step number one.
$78,000 to be exact, earned from the sale of the LaPorte Hospital.
We're not going to just throw money at the problem was the response we were getting from this new foundation. We're going to throw money at specifics.
Specifics generated by this revolutionary report. Maria Fruth, president and CEO of the Healthcare Foundation of LaPorte, says this project will address specific, albeit complicated issues.
To assess the burden of opioid addiction in LaPorte County, identify the community needs, gaps in improving adequate treatment services.
Now, for 27 years, different organizations in this town have run different programs.
Longtime community advocate Jim Musial has been involved with many of those in the past few decades.
But we seem to put out one fire and another one ignites down the street.
When I was actively using opioids, heroin, it was around, but it wasn't that big. You know, we were the outsiders. We were the ones that everybody whispered about. Whereas now, it's in your face, it's in our streets, it's in our schools, it's in our shopping malls, it's everywhere.
Finding out exactly where leads us to phase one of this report.
Assess the magnitude of the opioid abuse and consequences in LaPorte County.
Getting accurate data is the key component to all of this, knowing what we're dealing with.
That's where Center for Health Policy Research analyst Marion Green comes in.
There are quite a bit of data that are already available. Secondary data sources that kind of point towards the problems and the consequences of opioid addiction here within our state. And also there's some information specifically at the county level.
Collecting data from sources like LaPorte County EMS, the assistant director says they've recorded 136 non-fatal overdoses so far this year in LaPorte County. And that number, of course, doesn't account for all of them.
When I was making the rounds and calling around, it's like whack-a-mole. I was going from one organization to another. It was very difficult to get anyone to tell me exactly how many people died from heroin overdoses last year.
That's why they're bringing in the experts, Marion's team, to sort through all the sources available.
It's information gathering, followed by a second phase, which is going to be for determining what capacity we have in this county to deal with this issue based on these statistics.
Identify resources and determine gaps.
We have Swanson Center that offers counseling, intensive outpatient treatment. We have 12-step programs. The big issues I'm seeing here right now that I deal with are trying to find available beds in facilities. And if you find an available bed, is it private funded? Because if so, well, then you need insurance or you need a hefty bank account to pay for it. If they're state funded, then the waiting lists are pretty extensive.
And again, you lose that moment of opportunity where an addict sincerely says, with all due intent, I'm ready to get help.
That's huge. And we have to jump on that opportunity. We have to seize that moment because I have watched what happens when we tell them, you have to wait. Because sometimes when we tell them that they have to wait, we're too late.
LaPorte community leaders are tired of being too late, so they're hoping this report enables them to take action as soon as they hear that cry for help.
And then the third phase is draft recommendations for a strategic plan.
So we're going to have this tool where we're going to be able to go out and get more money and more resources, but it's going to give us a very specific target, but it's also going to be very flexible and workable across the community for everyone involved. It's the real deal.
I think that is a pretty new approach.
And at this point, I think there's still more questions than there are answers, but we're trying.
Ultimately trying to answer this simple yet colossal question. How will it end?
How will it end? Okay, I wish I had a magic wand, but the hope is that we can address the issue by, reducing prescriptions that are unnecessary. I hope that we can do a lot of prevention, a lot of education to demonstrate that, this is not a good way to live or to die.
This will end when every component of our country comes together. We have to have public and private partnerships, better public and private partnerships, not driven by what the political agenda is at that time, but driven on what the real problem is and what the real solutions are.
I don't know how it's going to end. But if we don't start doing more than what we're doing now, I can tell you how it's going to end for a lot of people. And it's only going to spread. But we're trying. I give a big high five to LaPorte County for the steps that have been taken over the last couple of years to really aggressively start trying to figure out how, where, when, what can we do, how can we make a difference.
Now, Tony had a pretty fantastic analogy for what it feels like to be told to wait when an addict is ready for treatment. So check out that Addicted America Raw web-exclusive video on abc57.com. And I also can't forget to mention that this final report will be released on March 31st, 2018. I'm live in the newsroom. Jess Arnold, ABC 57 News.